Hi, my name is Dr. Abha Agrawal, and I'm a practicing physician. You have all heard of the Hippocratic Oath that is often invoked by healthcare professionals: first, do no harm. Today, I want to talk to you about the problem of medical errors and patient safety, which is a little bit opposite of first, do no harm. You must be thinking, when we go to hospitals, we go there because we want to get better, we want to get cured, we want to get healed. That is correct. However, the sobering reality is that being hospitalized or any interaction with healthcare also poses a risk to your lives because of the problem of medical errors. Let me make it clearer. Approximately 1 in 10 patients who get hospitalized are harmed as a result of hospitalization. 1 in 300 die during hospitalization from potentially preventable medical errors. That is a total of about 3 million people every year around the world dying of medical errors. Let us put this in context. During the COVID-19 pandemic, over the last 2.5 years, approximately 3 million people died of COVID-19 every year, and approximately similar number of people have been dying of medical errors over the last years and decades. In US alone, medical errors cause about 250,000 deaths every year. That is equivalent to 2 jumbo jets full of passengers crashing every single day in the United States. Another way of looking at it, if you look at the causes of death, the leading causes of death, the first two are heart disease and cancer. And if we compared the numbers, medical errors would be the third leading cause of death. This is almost unbelievable. You say, how come I have never heard of that? Well, this issue first came to the attention in 1999 when the Institute of Medicine, presently called the National Academy of Medicine, published a report called To Err is Human. It jolted the medical world by bringing to the fore the problem of medical errors and patient safety. The good news is there has been a lot of momentum from WHO to most countries now have some sort of patient safety strategy, to organizations like the Agency for Healthcare Research and Quality, to public reporting of patient safety, to designation of patient safety officers and quality officers in many hospitals. But the sobering reality is none of those strategies have been able to make a sufficient dent in the problem of medical errors and patient safety. Why is that? It is because it's a very complex and sensitive problem. Complex because healthcare inherently is very complex, and therefore solutions will have to be designed locally. Solutions will have to be designed in partnership with patients and families. I believe that is one of the most critical elements that has been left out of this equation, and we must engage patients and families in solving the problem of medical errors and patient safety. We must also collaborate with physicians and nurses and pharmacists and healthcare leaders, to payers, to governments, to insurers, to business executives, to healthcare administrators, to make sure that we can start to talk about patient safety, make it mainstream, and start to save lives. Now you must be thinking, why all this discussion about patient safety? I am resourceful, I'm rich, I'm powerful. I go to some of the best hospitals in the world. I really shouldn't have to worry about patient safety. Maybe it is a problem of under-resourced hospitals or incompetent doctors. If you are a doctor, you must be thinking, well, I'm a great doctor. I practice at a great hospital. I don't need to worry about the problem of patient safety. This is a problem that happens to other people and their patients. Let me share with you 3 stories that will highlight the problem for you so that you know that the issue of medical error can affect anyone. It can affect you and me. It can affect your life and my life. The mother of late Bollywood actress, late Sri Devi, was diagnosed with brain tumor in 1995. Obviously, she was resourceful, she was rich. So the mother was taken to Memorial Sloan Kettering Hospital in New York, one of the foremost cancer centers in the world. She was operated by the head of neurosurgery there, one of the foremost neurosurgeons, the most expert neurosurgeons in the world. The problem is her tumor was on the left side of the brain. However, somehow the x-rays and CT scans that were displayed in the operating room showed a tumor on the right side because they belonged to another patient by mistake. Such a simple clerical mistake was able to undo all the expertise and resources of a great hospital. The surgeon operated on the right side of the patient. Obviously, there was no tumor to be found. And then she had to be operated on the left side, which left her in a vegetative state for the rest of her life. Let's take another example. Another great hospital, Cedars-Sinai Hospital in Los Angeles, California. Hollywood actor Dennis Quaid, his newborns went to that hospital. And because of a mislabeling of the syringe, they received thousands of times higher dose of a common blood thinner medication, which could have caused life-threatening fatal complication. Fortunately, the error was caught and the babies were discharged home safely. A 42-year woman in Japan went to her doctor because she was having uncontrollable abdominal pain. Nobody could figure out what it was. And then finally, when the CT scan was done, it was discovered that she had 2 large pieces of gauze left inside of her because of an operation that was done 6 years earlier. So these are just some examples. In the next time, I'll share with you my personal stories that will tell you how anyone and everyone can be impacted with patient safety. I will share with you 2 stories, both as a patient as well as a physician. One thing that I must share with you before we finish this video. The medical errors, as soon as somebody hears of medical errors, the first instinct, the knee-jerk reaction is to blame your doctor, your nurse, your pharmacist. That would be exactly the wrong thing to do. We know that the problem of medical errors happens because of complex systems, because of processes that are very complicated, and the safety processes that are not hardwired in the system. It is not because of negligent, uncaring, incompetent professionals. I have personally been involved in analyzing thousands of adverse events, and I can tell you it's extremely rarely that I have come across an uncaring and incompetent professional that led to the medical errors. So we must keep that in mind so that we can have an honest, open, transparent conversation about patient safety and medical errors with the hope that we can save hundreds and thousands of lives around the world. My vision is zero harm from medical errors to anyone, anywhere in the world. With that, I will see you again with more about patient safety. Thank you.